Hello, everyone. This is Jonathan Marks. I'm from New Brain Nutrition and Eat to Be Nice. And today we're talking with Dr. Alexander Hage, who you can also see here. He's in Mannheim, Germany. He's in the Department of Child and Adolescent Psychiatry and Psychotherapy at the Central Institute of Mental Health in Mannheim. And it's a beautiful day there. We are both part of Eat to Be Nice, which is a project funded by the European Union Horizon 2020 research program. And we are putting ourselves on the web as New Brain Nutrition. So you're watching newbrainnutrition.com, but this project officially is Eat to Be Nice. So I'm gonna turn this over to Alexander. We'll turn off our cameras so that you can see the slides full screen, but we just wanted to introduce ourselves.
Yeah, my name is Alex Hage. I'm a child and adolescent psychiatrist and psychotherapist. I do work as a consultant at the Department of Child and Adolescent Psychiatry and Psychotherapy in Mannheim, Germany, in the Central Institute of Mental Health. And I'm also the head of the research group Pediatric Psychopharmacology. And I'm also a member of the EU-funded project Eat to Be Nice. I'm working for a clinical trial that we call the VANTASTIC Study. And VANTASTIC stands for Vitamins and Nutrients as Supplementation Therapy for Impulsivity and Compulsivity. I would like to start by explaining briefly what we mean by impulsivity and compulsivity. Impulsivity is defined as the tendency to act quickly and unpredictably without apparent concern for consequences. And that means that you say something or do something without thinking about it first. And this normally is not a bad thing. Typically, everyone is more or less impulsive, also depending on the circumstances and the situation. But impulsivity can become a problem when it really impairs your everyday functioning. And in particular, high levels of impulsivity can also be part of mental disorders, such as ADHD or borderline personality disorders, bipolar disorder, and so on. The other important term for us is compulsivity. And compulsivity is the performance of repetitive and functionally impairing behavior without adaptive function, performed in a habitual or stereotyped fashion, either according to rigid rules or as a means of avoiding perceived negative consequences. And such acts or such behavior can be compulsive washing of the hands, that's pretty typical, or checking things again and again, counting, repeating, eating, hoarding, gambling, and so on. And compulsivity can also be a symptom of several mental disorders, such as substance abuse, eating disorder, autism, and of course of obsessive compulsive disorder. We do have many options to treat symptoms such as impulsivity and compulsivity. For example, with psychotherapy, such as cognitive behavioral therapy. If we think of children with high levels of impulsivity, often something like a parent training might be helpful for those impulsive children. We can treat with medication, such as stimulants for ADHD, or such as certain antidepressants for OCD, obsessive compulsive disorder patients. So there are effective treatment options, but every treatment option has pros and cons, and we always need to ask ourselves, how strong is the evidence that it works? How effective is it? Which side effects could occur? And also, is it available for the patient where he lives? And is it feasible?
Alex, you mentioned before cognitive behavioral therapy. Two questions about that. Can you describe that a little bit? And also, because you're a pediatrician, Can you also say at what age that cognitive behavioral therapy
cognitive
can be
behavioral
recommended?
therapy can be addressed to patients even at a low age, even children 6 years, 7 years, 8 years or older. But typically, if you think of adolescents, it is often more effective. But there are good results and there are good clinical studies that it can help in patients, for example, with high levels of compulsivity, and also in patients, for example, with ADHD, which show high levels of impulsivity. We are always looking for new treatment options, looking for alternatives, for example, for those patients who do not respond to usual treatment. And the question we are currently asking ourselves is, are broad-spectrum micronutrients a new treatment option to treat such symptoms like impulsivity or compulsivity? Are they helpful? Are they effective? And are they safe? So let me just briefly explain what we mean by broad-spectrum micronutrients. Micronutrients are essential elements required by our organism, for example, vitamins or the different vitamins that exist, but also major or trace minerals. So all these vitamins and minerals are micronutrients and they are essential for the human organism and the human brain. And we want to know whether a supplement of broad-spectrum micronutrients helps to treat impulsivity and compulsivity. So first, the question now is, why should that help? And we need to say that unfortunately the mechanisms are likely very complex. But what we know is that vitamins and minerals are cofactors in many metabolic steps important for the synthesis, for the uptake, for the breakdown of neurotransmitters. And the hypothesis is, or at least one hypothesis, that mental disorders and symptoms are based on metabolic dysfunctions important to the human brain. And in patients with mental disorders, the normal intake of vitamins and minerals is insufficient for an adequate synthesis of neurotransmitters. So broad-spectrum nutrient supplementation might therefore help to significantly reduce such symptoms. This is roughly said the one idea, one hypothesis why broad-spectrum nutrients might be effective.
Alex, can you describe for us what the functional neurotransmitter is?
We do have many different neurotransmitters in the human brain, for example, dopamine or serotonin, and we do know that a dysregulation of those neurotransmitters probably is the reason for many different mental disorders. And we also know that by changing or influencing this, for example, with medication, we can treat such disorders or reduce symptoms. For example, also such as impulsivity or high levels of impulsivity.
And so what you're saying is that you're testing to see whether vitamin supplements or mineral micronutrients can also assist with the proper,
exactly.
I guess, development
that is
of
the idea or the
neurotransmitters.
hypothesis. One hypothesis behind
it.
Yeah. I am a strong supporter of evidence-based medicine. So the question I ask myself is there evidence for the efficacy and safety of broad-spectrum micronutrients in the treatment of those symptoms? So is there any data? Are there any clinical trials? And the answer is, first of all, there are some methodologically well-done clinical trials, like those two done by Julia Rockledge and her colleagues. And what they did was they investigated the efficacy and safety of micronutrients in patients with ADHD. The first clinical trial was a double-blind, randomized, placebo-controlled study in adult patients with ADHD, 80 patients, and they received for 8 weeks a treatment with micronutrients or with placebo. And as a result of this study, they found a significant between-group difference favoring the micronutrients on self-ADHD rating scales and on observer ADHD rating scales. But on the other hand, they found no significant between-group difference on clinician ADHD rating scales.
So what you're saying is that there were significant differences as reported by the patients and possibly observers like parents or spouses, but the clinician didn't really recognize significant differences.
Inconsistent outcomes, and in a way it's hard to say whether the treatment really is significantly effective or not.
Right. And just so we're clear, for people who may not be familiar, a double-blind, randomized, placebo-controlled study is where you have part of the participants are taking the product that you want them to take, such as the micronutrients and the vitamins, and others are taking a placebo, and it's double-blind because the patients don't know, or the participants don't know if they're taking placebo or your product, and also the researcher doesn't know whether you're taking the product or the placebo, and everybody's put into one of those two groups in a random way.
Exactly.
So that's what we mean by double-blind randomized.
Because we know there's, with every intervention, there can be a placebo effect, and we want to balance that in the two groups. So if the micronutrients really have an effect on their own, you would expect a significant higher improvement in that group compared to the placebo group. The other clinical trial, I just want to show these results, but comment it just briefly. The other clinical trial was also a double-blind, randomized, placebo-controlled study with children with ADHD, children 7 to 12 years of age, in total 93 children. And they received 10 weeks of treatment with micronutrients or placebo. And again, the results were inconsistent. So it's really hard to say whether the treatment has a clear and significant effect or not. That means in total, if you think of all the clinical trials that were done so far, we need to say that the total data is insufficient. And for example, if you take a look at clinical guidelines, evidence-based clinical guidelines, for example, for ADHD or for OCD, obsessive compulsive disorder, they do not recommend to treat with broad spectrum micronutrients, even though it might really help. And another problem is that no one really can tell which combination of which vitamins and minerals in which dosages to use. So there are many open questions on the one hand, but on the other hand, people do buy those nutrient supplements. And there are substantial sales, and people buy it and they consume it and they hope that it helps. And they hope that it can improve their mental health. They hope that it can improve their well-being. But again, the question is, can we recommend to try those micronutrients? And I say the answer is that we need more clinical trials and we need more data to give a proper answer to that question.
So I will add here that before we talk about the VANTASTIC study, that we do have a separate video with Julia Ruckledge presenting, and she talks about her research in more detail. And Julia is part of the Eat to Be Nice project.
So what we plan to do with the VANTASTIC study is we plan to do a randomized, double-blind, placebo-controlled trial to investigate the efficacy and safety of broad-spectrum micronutrients in the treatment, in particular of adolescents with high levels of impulsivity. And we plan to include a pretty large number of participants, 180 children and adolescents. And we plan to include them into the trial, which consists of 2 parts. First, a 10-week placebo-controlled phase, followed by a 10-week open-label phase, which you can see here on this figure. And our primary outcome, our primary objective is to have a look at the response rate at the end of the placebo-controlled phase in terms of the reduction of the impulsivity. So the primary outcome is, our primary question we address to this study is, do the high levels of impulsivity, can we reduce them by giving micronutrients? And moreover, we do have a really large range of secondary outcome measures. We also want to know, do the micronutrients have an effect on compulsivity? Do they have an effect on ADHD symptoms overall? We also want to know, do they have an effect on sleep problems, on aggression? We want to know if there are any side effects to be expected when giving micronutrients. We want to know how is the treatment adherence in patients who take the micronutrients, and we also want to understand the underlying mechanisms and the biology.
So, Alex, you mentioned in the previous slide, you're looking for a 30% reduction. What happens if you get a 25 or a 20% reduction? Will you say there's not a significant difference, or is 30% just an idealized
goal? Our primary objective is that we said we choose a definition of response, and we try to find out whether the number of patients in the micronutrient group who respond to the treatment is significantly higher compared to the other group. But we will also have a look on the scales and on the symptoms in total and compare the reductions, and also compare the reductions in terms of other symptoms.
And also, when you say you're taking a look at the microbiome, this is another interesting aspect of the Eat to Be Nice study. We'll be learning more about this with other presentations. But can you speak just briefly to how that's being measured?
The microorganisms that are in the gut seem to play an important role, even though for mental disorders or mental symptoms. And we would like to understand in how far, for example, adding vitamins, minerals, micronutrients could lead to a change of the microbiome, and therefore, in a second step, maybe to a change of mental symptoms.
Thank you.
Okay, my conclusion for now is that broad-spectrum micronutrients could present a new effective treatment option, but they could also present a hype, and it could also be that they do not help. So hope or hype, that's the question we ask, and we would like to help finding out by our clinical trial.
So Alex, you're in the process of just beginning the trial. When do you think we're going to see results?
Yeah,
what
we will
month or
probably
year?
start
How long does this
and
take?
have our first patient in this summer. And then we try to find, as I said, about 180 participants. And we will hopefully, after a year or two, have sufficient data to do the analysis and have the first results.
Got it. So this is probably
Yes,
like
yes.
2020 or 2021 that we're talking about. I think it's just helpful for people to have an expectation, because this is very exciting research. It's a great hypothesis. And if the results show that this could be a new treatment option, it's a very exciting development.
Very excited to see whether it shows an effect or not. And as you maybe know, it's always crucial and difficult to find participants. So we hope this is interesting and is a new option for those who really suffer from these symptoms and would like to try out something new. Okay, and that's basically the end of my presentation, and I would like to thank you for your attention.
Thank you very much, Alex. The VANTASTIC Study is fantastic. We're really excited about this as part of Eat to Be Nice and New Brain Nutrition. And I want to thank very much Alexander Hage for being with us today. And we hope you've learned some more about what the kind of research is being done to see if micronutrients and vitamin supplementation can help with mental health. And the big question, as Alex said, is it hope or is it hype? And it's possible it can go either way, but the important thing is that we are doing the research to find out how micronutrients and supplementation can assist with mental health improvement. And Alex, thank you very much for your presentation. We wish you the best of luck in the research and hope it goes well.